My name is Dr. Dogan Sahin. I am the oral surgeon. I graduated from the Istanbul University, the eldest, at the same time the biggest medicine faculty of the Turkey. I have about aesthetic cosmetic dentistry, lots of certification, also run implantation. But the most important two certificates I can tell from Professor Alper from Istanbul University, bone augmentation, bone transplantation certificates. I'm very proud about them. Also laminate veneers education from Yeditepe University, Professor Esra. Also about digital supported implantation, I wrote 96 pages thesis on this.
Could you say more what kind of advanced technologies do you use?
In our clinic, the most important advanced technology, as I said before, guided implant surgery. For that, we take 3D computer tomography from the patients. Also, we have intraoral scanners in our clinics. We take all of this data and we upload to this data to the computer programs. We are making surgery on a computer program actually. Digitally, we are making surgery during patients sitting at home, drinking his tea and coffee. We decide everything, how many implants, which angles, which size we will use. Then we prepare some placas special to the patients. When the patients come to our clinic, we fit placas and we send implants from that placas without cuttings. This is the most important technology we are using in our clinic, I can tell. Another, also we are using piezo surgery with ultrasound machines. We have lots of ways for cutting techniques for the bones, but with this piezo ultrasound technology, it's less invasive, less traumatic, and patients doesn't feel after surgery very big pain or swelling. Usually these piezo surgery machines throat, nose and ear doctors using for rhinoplasty.
Yes.
But we are using this technology also on dentistry. Yeah.
And what are the advantages for the patient when you are using digital implantology?
Digital implantology, it's actually all the surgery actually a kind of trauma. And we say if you are gentle to your tissue, to your body will be gentle to you. It's very big part of healing procedure. If you make more trauma to the tissue, to the bone, to your body during the surgery, your body will give bigger reactions to you. That's why we always try to make less trauma, try to be more gentle to our body, to our surgery areas. With digital technologies, it's possible. For example, if you want to send 4 millimeter implants, normally you should cut 50 millimeter area for that, just for 4 millimeter implant. But with digital implantation, you don't have to cut very big areas. So with this kind of less trauma, post-operative term, patients feel more comfortable, less pain, less swelling. And that's why we always try to use, of course, if it's possible with the patient.
You are talking about piezo now.
I am talking about the guided implant surgery. With piezo, usually we are using this machine for bone transplantation if the patient doesn't have enough bone in upper or lower jaws, for example. We are taking some bones from patient's jaw, especially the back side of the jaws or front side of the jaws. We bring this autogenous bone from the patients to the receipt area. We fix this and we are putting some artificial also bone graft. We are making mix from your body part bones and also artificial bones, 50%. We make mix and we are putting this. And during these surgeries, before taking the bone from the donor area, we are using piezo surgery with less trauma.
I see. And from which areas do you take the bone?
Lower jaw, the back sides, that area we say in medicine language ramus of the mandible or symphysis of the mandible, we call it, yes.
And it is restored with the time?
Yes.
this bone has a quality to restore itself.
Yes, restored itself also. Yes, also we are putting some artificial bones that is donor areas. But what is good with these techniques, actually, we are not bringing 100% artificial materials from outside. Also something from the body. So it makes easier for accepting, for adaptation, the new bone.
Could you tell more about all-in-4, all-in-6 implants? What does it mean for the patient when it is indicated, and what is the difference between two?
The answer in the question, all-on-4, as we can understand, everything on the 4 implant actually, or all-on-6, everything on the 6 implants. How we decide these treatments? We always prefer to put more implant for take more support, of course. Or first opinion, always try to replace 6 implant, all-on-6 treatments, but unfortunately, sometimes we cannot find enough bone for replacing the implants. This position, secondarily, we are thinking all-on-4 treatments. Yeah. All-on-4 treatment, we replace 4 implants, and we are waiting normally between 3 or 4 months for integration between bone and the jaw surface. After integration, implant, it takes sometimes 3, sometimes 4 months, or if you make advanced surgery like open sinus lift, 5 months. We are fitting the crowns, 12 crowns on top of all-on-4 treatments, and we are finishing. But if you have enough bone level, we always try to put more implant. The more implant, the more success, I can tell. Yes.
And what is your preferred brands for implants?
Actually, all of the implants made by the same material, titanium grade 4 or titanium grade 5. But there can be some different surface technologies, depends on the brand marks. But sometimes secret is hidden under the small details, you know.
Yes.
Yeah. That's why I always try to use the international brand marks like a Straumann Group or Ostem Group or Astra Group. I prefer all of these technologies, and they are also supporting us about the digital technologies. This is also important. Yeah. Implant surface can be perfect, but if they cannot support a doctor in the digital technologies, it's not good enough. It can be good, but it can be old technologies. About Straumann Group, I didn't leave any trouble for that. I cannot tell another brand mark are very bad, of course. But commonly I am using this. Like it's a little bit something like some people likes Mercedes, some people likes BMW. You cannot tell another is bad. It's my prefer, it's my choice. I'm using these brand marks. But I can tell most ofly they are making from the same material, titanium.
When you say support digitally, what do you mean?
For example, with the Straumann Group, we have the digital copies of the implants in the computer program. We can use guide implant with these brand marks. But if the brand mark doesn't have the copy in the digital library, you cannot use this implant. You should use just conventional ways. Yeah. But nowadays, most of brand marks start to turn to these technologies. I can say Straumann Group is one of the leaders implant brand mark about making these RG workings, digital technologies. Yeah. And also from South Korea, I can tell Ostem Group. In my clinic, I never lived trouble with these implants. Experience very important. Surgeon experience, of course, very important, but brand marks experience also very important. If you use for long-term ship brand marks, when they leave some troubles, they change, they make some RG workings and the new models, making. Also, certification very important for me. I always tell my patients, you can make your implant here or in different clinics. Always ask your doctor, will you give me my guarantee certification? This is very important. If they can take this kind of legal papers, doesn't matter. Another things, the surgeon. You should choose good surgeon. I can offer all the brand marks. Yeah.
And speaking about the guarantee, what are the guarantee for the implants and for the crowns?
For the implants, implant treatments, there is two pieces. The body of the implants and top of the implants. The body of the implants, the part which one is inside the bone. Most of the companies, at least the companies which I working, they give the lifetime guarantee inside the bone. Even in some situations, after traffic accidents, they give the guarantee. But of course, after traffic accidents, who will care about their dental implant? Just I want to tell the brand marks, trust their implants, I mean, yeah. If there is not trouble from the patient side, if patient loyal to oral hygiene, and if the patient's making her or his routine controls in the clinics, in our clinic we give lifetime guarantee. Top of the implants, the crown side, the which one is you are seeing in front of the mirror, our laboratory is giving 10 years about fragile, about color chance, everything. But of course we are not doing our job just for 10 years. We always want all the treatments to lifetime. Patients doesn't have trouble. But as I said, it depends also the patients
To take care.
Yes, important. I see lots of patients even after surgery they start immediately smoking, for example. Yeah, but if patient loyal to the rules, for body of the implants lifetime, for the crowns 10 years we give guarantee. Of course the patient's bone level is suitable, we can immediately load the implants in once after extractions. And for that you should use some aggressive implants which companies can have these brand marks, this implant. You cannot do this with all the brand marks. Implant company should have this specialization for that implant. I always try to make all my surgery in once. Why? Because surgery always makes people afraid, and sitting the dentist armchair again and again can make people a little bit mentally tired, afraid. So I always try to finish everything in once, in one injection, in one anesthesia. When I give to the patients, finish my job if the patient is suitable, if the implant technology is also good enough for that. But sometimes unfortunately it's not possible, and during this time we just wait one regeneration and then second surgery. After my implantation we take the measurement with intraoral scanner, we prepare a fixed plastic temporary. It's more comfortable, but you should keep the rules. For example, you cannot eat hard foods, hard things. For example, I say if you want to eat potatoes, not fried potatoes, but boiled potatoes. During this healing procedure, 3 months, 4 months, you should be very, very careful. Especially first 1 month, 4 weeks, very, very important also. After implant integrated to your bone, when we fit the permanent crowns, you can eat what you want.
I see. And do you visualize with the patient the final result when the patient is on the consultation? Do you see, can you show to the patient what will happen in the end?
Then I was talking about the digital technologies. Another side also related with the aesthetic results, aesthetic expectations of the patients, for example. In our clinic, that's why I said the brand mark of the implant support the digital technologies. Normally, we are taking the measurement of the mount with the silicones from the patients. And we send this silicone to the laboratory. They are putting some stones to the silicones. They make the copy of the mount, patient's mouth. And he prepares something and sends us. We make some provas and try to change something. With the digital intraoral scanners, and you take the copy of the mount with small camera, and when you take the picture of the face of the patients, you can customize your final restoration according to patient face, special to these patients. In our clinic, we are using this technology, for example. After implant integrated to the bone, we take measurement. We have the photograph studio with the professional machines. We are taking the pictures. We send all these photo and videos, also intraoral scan data to laboratory. Laboratory upload to this digital smile design program. According to face, or laboratory technician making a design, we bring this, but this is just plastic crowns. We fit this to the patients. We take again pictures and we show these pictures. Also, we let the patients checking in front of the mirror, everything. If patients say, that's okay, doctor, I like this design, everything, you can produce these crowns. We send this design to the permanent zirconium or IMAX machine, and we produce the permanent ones and bring and fit the patients without bad surprises. Or if patients wants to change some details, for example, some of patients likes Sharpie cannons, some of patients like a rabbit teeth. It depends on the patient's expectations. If a patient wants some more change, we take all of these notes, send with the pictures to laboratory again, laboratory making redesign, we bring to the patients. Maximum in second provisional fitting, we are catching the expectations of the patients. And when patients says, I confirm, it's okay, I like this shape, size, everything, then we decide the color also. And we let the laboratory produce and bring and fit. So our patients can see the final result before fitting the permanent ones. Yeah.
I see. And for how long the patient should stay for the implant, the placement, and for the crown, first and second visit?
For implantation, actually, nearly per implant replacing, I can say 15 minutes. Just for all-on-6 treatment I am talking about.
I mean in Antalya?
Yeah. Six implant upper jaw, 6 implant for lower jaw. It takes maximum 3-4 hours. Both jaw, all implant surgery finish in 3 hours, maximum 4 hours. One day we can finish the surgery, but we don't want to send our patients from here without controls or checkings. Also, as I said, we are preparing fixed plastic temporaries to patients, and we need some time producing all of this in the laboratories. It takes 2-3 days. 1 day surgery, 2-3 days laboratory producing. I can say in 4-5 days we can finish. But if it is possible, we would like patients stay in Antalya 6 nights, 7 days for making the last control. Then send our patients in secure here, like as a, also consciously check everything in 1 week. Yes, we fix everything. For example, stitches good, your gum is good, everything okay, then you can go. Maximum 6-7 days for the first visit I am talking about, enough. For second visit, after first visit 3 months, 4 months, again 6 nights is enough for preparing the permanent crowns. So totally 1 week first visit, for second visit also 1 more week. Usually good enough. If we will not do very big surgeries, advanced surgeries, then standard procedure, 6 nights, 7 days, enough for first visit and second visit.
Even if you do sinus lifting and bone grafting, 6-7 days is enough, or it extended the stay?
For the first visit, if you make the surgery, I usually say like 8-9 days is better, because after, it depends actually, it depends on which surgery you made. With sinus lift, you have 2 ways, like a closed sinus lift and open sinus lift. Usually, I try to use the closed sinus lift, less invasive. But how we decide which surgery technique we will use? If the sinus floor and the bone jaw level, if there is very big distance, if there is enough spaces, for example, you need just 1 millimeter, 2 millimeter bone extra, I'm using closed sinus lift, not making advanced surgery. We are using some osteotomy machines, making the sinus floor a little bit upper, 1-2 millimeters. We send the implants. But unfortunately, sometimes even there is no bone between the sinuses and the jaw. We need to make open sinus lift. This is a little bit advanced surgery. We are opening a surgery area. We are sending the bone graft and again close that area with the membranes, then close with the patient's gum. After this kind of surgery, we don't offer the patients immediately using the fly because if the cabin pressure is changing when they are flying, not just fly, also scuba diving, for example, we don't offer. For this kind of patients, usually like 9 days, 10 days, I want to keep the patients here, stay. I want to take my last control, x-rays, everything is good. Then I want to send just 2-3 days, a little bit more. I want patients stay here.
And for the all-in-4...
But I can say this is just, sorry, I am interrupt you. I can say this is the implant patients maximum 10 or 15% of this kind of patients desperate.
All-in-4, all-in-6 implants can be done in one visit, or they should come 2 times too?
I said if there is good bone level or some small need patients, small bone augmentation, just a little bit, in one, yes, we can do. 5% or 10% of patients really doesn't have no bone, I can say. For this kind of patients, we need to first support the jawbone, one surgery, then in second visit we can replace the implants. But as I said, this kind of patients very less, very rare, not commonly, 5% or 10%. Very old age, for example, or maybe for a long time they used denture, or some of young people can have some traffic accident or some bad infection, big cyst infection, tumors, or this kind of things. First you should support the jaw, but I said it's very rare.
All-in-4, all-in-6 implants are indicated for people who doesn't have any teeth, or they can have just
some of they can have, but insured, like damaged teeth, like for a long time, repeat and repeat treatments, crown treatments, they try everything, but it's not successful. Sometimes patients have teeth, but it's shaking in the jaw, not good enough support from the bone and the gum side. We check everything, x-ray, if needed, 3D computer tomography, then we decide is the patient's all-on-4 or all-on-6 treatments. But usually it's the last stop of the dental treatment if patients again and again treatments. First option we always try to keep the natural teeth, natural roots of the patients in the mouth, of course. Because at the end of the day, it's the artificial something in your mouth.
Right.
Yeah. But if there is no another solution, patients cannot chew, bite. And if patients, for example, get tired of visiting every time the doctor and cannot find the solution, then we decide, okay, radically we decide everything, extract the teeth and replace the implants and sort thoughts.
Thank you very much.
You are welcome.
It was
Nice
very
to see
interesting
you.
talk. Thank you.
You are welcome, always.